And we are live. It's Dr. J here in the house. Hope everyone is doing phenomenal on this fabulous Friday. Let's dive in. What's on the queue here today, y'all? All right. First thing here is Dennis writes in, I heard a chiropractor say that beta endorphins are 33 times stronger than endorphin or than morphine. Is that true? I've heard things like that for sure. Beta endorphins made from 19 different amino acids, so we need good protein to make beta endorphins. You can hit some of those receptors also with CBD as well. But yeah, it all depends upon the root cause of what you're trying to do with that from a pain perspective. Do you recommend bone density testing after age of 60, or is it not necessary? Yeah, you could do like a DEXA kind of a DEXA scan, or to look at your Z and T score of your bones. That's fine. I think it's okay. Stephanie writes in, can you talk about endometriosis from a functional medicine perspective? Do you have experience working with patients that have it? Yeah, I do. Endometriosis is an inflammatory condition where the endometrial tissue grows outside of the uterus lining. So it can grow on top of the uterus, it can grow on the intestines, bladder, and typically inflammation tends to drive it. Inflammation from insulin resistance, excess estrogen, hormonal detox issues, estrogen dominance, all those things are driving factors. So you got to look at all the potential vectors for inflammation. You got to look at all the hormones, got to look at hormone metabolism. All these things are vitally important to get to the root cause of why that's an issue. All right, great questions there, great questions. Let me keep on rolling here, y'all. All right, please explain riboflavin and its relationship to methylation and ATP, please. So riboflavin is B2, B vitamin 2, and B2 is an important cofactor in the Krebs cycle. So when you go into like a textbook and you look at the Krebs cycle, right, basically you have, I think it generates, 4 ATP, but essentially you have, I think, 4 NADH that occur from it, and then 2 FADH2. So basically these are reducing compounds. They're grabbing hydrogens, right? They're grabbing electrons to then enter the electron transport chain. That's the goal of that. And to pump these reducing agents around, right, NADH and FADH2, you need B vitamins, you need magnesium, you need amino acids. So it's just important to pump that Krebs cycle around so then you can generate these reducing agents, essentially these extra compounds that are holding on to electrons that can be now tossed into the electron transport chain. I think it's like 2 ATP for glycolysis, 2 to 4 for the Krebs cycle, and then the other 34 or so come from the electron transport chain. So it's like 36 to 38, I think, total ATP. How do you recommend probiotics are taken? What time of day? So typically in the morning, as soon as you get up, and then bedtime is good. If they're spore-based probiotics, we'll do them with food. Typically other ones that aren't spore-based, like Bifido or Lactobacillus or Saccharomyces, we'll do on an empty stomach. Is it possible for food sensitivities will never go away with autoimmune disease? Normally, you can reintroduce foods after not eating them for a period of time. What's the difference here? It depends. There are certain foods that are like just naturally inflammatory, Riley, that like gluten or certain dairies that may never be able to go away. And then there are certain more food sensitivities on less inflammatory foods, maybe like nuts or seeds or butter, maybe eggs. And these foods will be able to be added back in as your gut gets better and heals, and as your body has, let's say you've taken them out of your diet for a bit of time, so then your immune system is not hyper responding to them. You may be able to add them back in months later once your gut's better and add them back in. So there are foods that are more inflammatory and less inflammatory. The greater goal is to try to get the less inflammatory ones back in. And the good rule of thumb is if you love it, rotate it. If you love it, rotate it. Mindy writes, 1.5 years ago, I tried to combine keto and 16-hour fasting for a few months. My ability to sweat decreased. Even now, pregnant, I don't sweat like I used to. Okay, got it. Not sure there's a question there, but good to know. At the same time, I started breaking out in hives on my arms. Okay, part 2, when I work out, mainly around ovulation, I feel like I rewired something in my body. Any insight? Hard to say. Hard to say there. I really have to look at digestion, hormones, inflammation in the guts. I mean, if you're getting hives on your arms, I would definitely look at gut inflammation, and I would pull histamine out of your diet to see how much that may or may not move the needle. Good questions. Good questions. Have you tried Bacopa? What do you think? Yeah, Bacopa is a really good kind of adaptogenic compound that has good benefits in increasing acetylcholine, which can help with memory and cognitive benefits. So I definitely like that. I think that's great. Bacopa is really, really good. All right, excellent, guys. Great. Great questions today. Appreciate it all. What do you think of supplementing with NAD+? You can do that. So there's a product called Niagen that has that in there. You can also do niacinamide. Niacinamide is also something that you can do to increase NAD. So you basically increase some of these reducing compounds so the Krebs cycle or citric acid cycle can work more effectively. Yeah, that's fine. From an anti-aging standpoint, that's a good thing. I personally don't do it. I do other things, but I think it could be beneficial and something that's on my radar for sure. Vivek writes in, Dr. J, should one be concerned of an overdose of B12 from supplements, as B12 stored in the liver, and zinc toxicity from supplements? Well, with zinc, unless you're taking actual zinc products, most people are only getting maybe 30 to 40 grams of zinc supplemental. I'm not too worried about that. Most people are low in zinc. With B12, yeah, I mean, if you're taking a lot of it, a lot of extra B12, and you're testing your serum levels and all of your white blood cell or your red blood cell markers are looking good, meaning your MCV, MCH, MCHC aren't high, methylmalonic acid on an organic acid looks good, then you can pull any B12 supplementation out of your protocol outside of maybe what's in a little bit of mitochondrial support or multi. How can you treat malabsorption, and what is a good probiotic? So for malabsorption, you have to follow the 6 R's. You have to cut out food allergens, you have to work on digesting your food better, and you have to get rid of infections that could be making it hard to break down your food. Tammy writes in, B-complex vitamins give me and my mom and daughter migraine headaches. Why? I notice Bs have methylated versions nowadays and since becoming sensitive. Your thoughts? So it depends. I'd want to make sure your gut's doing well, inflammation, food stuff's under control. A lot of times migraines in women can be connected to their cycle too, so I'd want to see if there's a hormonal connection to it. I like to look at your organic acids and see how you're methylating, to see how 4-aminoglutamate, to see how methylmalonic acid look, to see how the B vitamins look. That'd be important to know. And then from there, if we were still having issues, I'd probably separate out your B vitamins. I'd probably give you a B vitamin that does not contain folate and B12, see how we do, and then potentially add those B vitamins from the folate perspective, which is B9, and from the B12 perspective, I'd add those in separately in a sublingual form, but I want to see your organic acids first. Neon writes in, how are you doing? Doing great. Anyway, kind of binged on some rice beans yesterday that are cooked and cooled, pressure cooked, soaked, and rinsed them. Yeah, so if you're feeling off from that a little bit, you could always do some extra activated charcoal, right? Extra enzymes with it, and then you could always do some glutathione afterwards as well to help. Don writes in, hey Don, hope you're doing well. I have a friend who has a virus, feel bad, has phlegm, went to the clinic. It isn't flu. What would you suggest to hasten the recovery? So first thing is ginger tea has antiviral benefits, and it will help free up a lot of the mucus. If they have a lot of mucus in their frontal sinus, you can do like a good nasaline or a Neomed flushing thing, so you can flush xylitol and bicarbonate through the sinuses to get it all drained out. That's helpful. From a viral standpoint, I recommend my Immunosupreme, but some of the things that you can do will be like reishi or medicinal mushroom. You could do astragalus, higher dose astragalus, higher dose andrographis, higher dose echinacea, higher dose golden seal are all great. Viral, you can always do GI Clear 3 or silver. I have a really good article on the website, Don. It's called What to Do When You Get Sick, and the part 2 has a lot of the supplement recommendations in there. Hope that helps. What tests can I do to find out what foods are problematic? So first thing is do a elimination diet, and which would be like an autoimmune diet. See how we do with that, and then reintroduce food slowly. There are other tests that you could do. I'm not a huge fan of them, but from a food allergy standpoint, you could do like an MRT, or you could do an ELISA ACT blood test for that. Regarding the mucus stuff, you gotta look at food allergen stuff first if it's not like an infection. So look at food allergens first and see how we do. Should I avoid legumes if they give me super minimal amount of mucus? Cut them out. Yep. Problem is right now it's my only source of protein because I'm doing a modified vegan diet. So why are you doing a modified vegan diet? I typically don't recommend it because the protein sources in a vegan diet tend to stink. They're just lower quality. They tend to be lower in sulfur amino acids. You can do it if you're getting extra supplemental amino acids from rice protein or hemp or pea, because you're not getting all the carbs. The problem with a vegan diet, if you're not supplementing additional amino acids, is it's 70% carbohydrate. So to get an adequate amount of protein, maybe like half your body weight in grams of protein, you need like 200 or 300 grams of carbohydrate. And for a lot of people, that may be too much carbs. That's the problem with the vegan diet. People that do good on the vegan diet, they tend to be supplementing additional protein in a powder form, so they're not getting all the carbs. Number two, they're taking extra B vitamins and B12 and probably even iron, especially if you're a woman. And then number three is they tend to be more insulin sensitive, so they can handle more carbohydrates. That tends to be a factor that we see in people that can do it. They can handle more carbohydrates. Tammy writes in, great answer. I do confine individual B separately. Yep, no problem. Interesting. I'll follow your advice. Thanks for sharing and caring. Yep, you totally welcome, Tammy. You're welcome. Neon. Riley writes, had diarrhea for 1 week and took your GI Clear 4. 1 day later, it was gone. Yeah, that GI Clear 4 is great. The golden seal in there is really high. The berberines are really high. The black walnut. The burdoc's great for the lymph, so I'm glad you had some good success with that. Yeah, I had food poisoning over the summer, and it really, really helped. Raymond writes in there, improving circulation, is there any B vitamins that work best? For improving circulation, you want to reduce inflammation. So to improve circulation, thinning the blood, reducing inflammation is number one. So higher dose fish oil can be helpful. You can also do higher dose ginkgo or bacopa is good as well. Mo writes in, is it possible to feel like fainting when blood sugar is at a 5.0? I'm not sure what that correlates to US. So US, normally it's like 80 to 90 is a good level, right? 126 is diabetes, 110 is pre-diabetes. So I'm not sure what 5 correlates to. I feel like my blood sugar has to always be higher. I think I have adrenal insufficiency. Yeah, you got to correlate that blood sugar to an American level if possible. I think I might possibly have a 6-letter word that starts with AC. AC. Not sure what that means. Got to give me a little more specifics. One reason I'm trying to vegan out, I'm not doing it strictly though because I'm still using fish oil and B12. That's good. That's good. Fish oil is good. Yeah, you can do pretty good on a vegetarian diet if you're getting fish, high quality wild fish, and if you're getting egg yolks. You can still do pretty darn good on a vegetarian diet. If you're getting egg yolks and good quality fish, maybe you're having some cod liver oil, maybe you're getting some good wild Alaskan sockeye or salmon or cod, you can still do pretty darn good. You don't have to be a full-on meat eater. It definitely helps. I mean, some of the nutrients that are in animals, beef, for instance, they really concentrate a lot of the nutrition for us. They really are a superfood, I consider. And then you got organ meats, which really help as well. Andrea writes in, what do you find a main root cause for histamine intolerance? So the major root cause of histamine issues is inflammation in the guts. The more inflammation you have, the more histamine becomes a problem. So in the meantime, while you're having histamine issues, whether it's skin or headaches or rashes, you want to go on a paleo, autoimmune, and low histamine template. And then you want to work on the 6 R's, removing the bad foods, replacing enzymes and acids, repairing the gut lining and the hormones, removing the infections is step 4, repopulating, reinoculating good bacteria, good probiotics, make sure they're low histamine, and then retesting. Great questions. Excellence. Oh, got it. So you mentioned that, okay, cancer. Got it. So regarding with cancer stuff, you want to keep the carbohydrates low. I mean, I recommend more of a ketogenic template with still unlimited amounts of vegetables. Vegetables aren't really calorically rich, so it's very hard to get an adequate amount of calories from vegetables. It's very difficult. I mean, for instance, 8 ounces of grass-fed organic beef, I would have to have 15 to 16 servings of kale, right? So the difference is no one's having 15 or 16 servings of kale. It's really hard. You could juice some of that, right? It's very possible, but it's going to be very hard to get that amount. So the benefit of getting meat is you really get concentrated nutrition as well as calories as well. Can you talk about endometriosis from a functional medicine perspective? Do you experience working with patients that have it? Yeah, I already talked about that right in the beginning. So that was the first question you already asked. I answered that already. But yeah, a lot of experience on that. Take a look at the website, justinhealth.com, and use the search on there. Lots of podcasts on that. My blood sugar is at 90. Good. And I feel faint. Is it possible when I have adrenal insufficiency? Yeah, it's possible you have adrenal or thyroid issues. We'd have to do some testing for sure. Is psilocybin good for healing the brain from stress and repairing the HPA axis? I don't know. I mean, that's kind of like a mushroom extract, right? Psilocybin. Is that LSD? I forget. But either way, it's like a mushroom extract. I've heard lots of things about these different types of things. I'm not sure if it's healing per se. I would much rather look at fixing the gut, getting the inflammation down in the gut, really supporting the nutrition to run the brain, really helping the HPA axis. If psilocybin has adaptogenic effects, fine. I mean, I'm just not a big fan of the hallucination aspect of it. I think there's a lot of other herbs that you can do that would have a better impact on that. Sam writes in, help, my friend Rory has severe problems where he can't help but sniff seats on buses, trains, and public transportation. He drinks bathwater. Nice. Sounds like you're trolling there. All right, really appreciate it. You are totally welcome there. Awesome. Excellent. Any other questions, guys? Let me know. If not, I'm going to jump onto a patient call. Yes, it's from mushrooms. Yeah, it's a hallucinogen. I've heard some interesting things about that. Also, ayahuasca, those kind of things too. I don't know. I don't really have a strong opinion on it either way. I just think things that cause you to hallucinate are more palliative. They may provide a level of insight or perception that you may not have in conscious reality, but it's not really fixing anything root cause. What's the reason of long-term adrenal fatigue if one already is taking care of lifestyle and stress? You'd want to look at other underlying infections, other underlying nutrients that could be low, sleep. Just make sure overall everything else is good, because people think of stress as emotional stress. They're like, hey, my work stress, family stress, those things are good. But then you have to look at the food stress, and you have to look at the internal infection stressors that could be part of the equation. Okay, excellent. I think that's really good. Oh, Ashley writes in, can an OPK test reveal a false positive one always has high LH due to perimenopause? Possibly, but if someone has a very high amount of, it's more the surge, right? So if you're looking for ovulation, it's going to surge up. And so if you look at like Google image, like month-long hormonal just like month-long hormone cycle, right? You'll see it's like day like 11 or 12, LH surges, right? And so it's really that big shift. Now, if you're menopausal, it'll always be high, and yeah, you'd probably always be positive in it, but I think the surge may even be higher. I'm not sure, but you'd be having tons and tons of hot flashes and stuff and tons of menopausal symptoms. I don't think that would be the case in yourself. Now, if you see it high every day for days on end, that may be the case, but I'm not sure that is the case with you here, Ashley. All right, great. Any supplements on your radar? Not too much, I would say. I mean, I've been using a lot more of the immunoglobulins for the gut to help with gut lining and gut permeability. I like those for healing the guts. Always, liking different forms of adaptogens. Really, it's just getting very specific to what each person needs, because some people need things that are going to move the needle more than some other person. So if we can really get clarity on that, it really helps move the needle, and people, feel better and get to the root cause better too. Excellent. All right, y'all, any other questions from me here so far? If you're enjoying this stuff, thumbs up, hit the like button, give me a share, put your comments down below on things that have helped, things that haven't. Really appreciate your feedback on that. And you guys have a phenomenal day. Dr. J here signing out. Take care, y'all. Bye.